The views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Maayong Bernes sa gabi. Welcome to Soto Live. Ang Vicente Soto Memorial Medical Center Sub-National Laboratory nitala na sa mga musunod karong adlawng Bernes 17 sa Hulyo 2020. 582 ka samples ang na-test karong adlaw ug kini tanan gikan sa Central Visayas. Sa kinatibukan, 36,540 na ka samples ang na-test sukad sa pagsugod sa atong Sub-National Laboratory. Sa 582, 65 niini ang positive ug 517 ang negative. Suma total, aduna na kitay 8,353 ka positive samples ug 28,107 ka negative samples. 556 ka samples ang kasamtangang gadagan karon sa atong laboratorio. Pahinumdum lang sa tanan nga mga resulta base lang sa mga samples nga gitest. Ang Department of Health Regional Centers for Health Development ang mopagawas og detalyadong impormasyon mahitungod sa mga positibo o negatibong kaso. Daghang salamat.
Aniya na mga pinakaulahing balita kabahin sa COVID-19 dinhi sa atong tambalanan karong adlawng Biyernes petsa 17 sa Hulyo 2020. Ang Soto mirehistro na sa mga musunod. Sa kinatibuk-an, 854 na ang nakumpirmadong kaso diri sa atong tambalanan. 265 niini ang nakarecover na. 265 na ang nakutloan og kinabuhi nga naggikan sa laing-laing nga lugar. Ug sa kasamtangan aduna pay 75 ang padayong giatiman diri sa atong tambalanan. Ug 219 usab ang na-transfer sa atong mga isolation centers. For our bed utilization, VSMMC has a total regular bed capacity of 865 and currently we have 474 patients admitted in our institution. This gives us a utilization rate of 54.8%. Dedicated for COVID, we have 185 beds and currently admitted 105 patients. This gives us a utilization rate of 56.8%. VSMMC has an ICU bed capacity of 55 beds and currently we have 35 patients admitted. This gives us a utilization rate of 63.6%. Of the 55 ICU beds, 24 are dedicated for COVID-19 and currently we have 19 patients admitted. This gives us a 79.2% utilization rate. Daghang salamat.
Good evening, our stakeholders. Maayong gabi, Dr. Helen, good evening. And today, since it's a Friday, we have the COVID-19 weekly report. Karong gabi una ato ipakita kaninyo ang ato ang resulta sa usa ka semana ug ang mga figures nga dapat ninyo mahibaw-an ug anapod tay mga gitawag natong send off sa ato ang mga na-recover nga mga pasyente gikan sa ato ang extension hospital sa IEC ug naa sad niya ninyo ipatikim para sa atong walk-through, drive-through program sa free testing sa atong sub-national laboratory. And to start with the presser, Dr. Helen.
Okay. July 10, 2020, the DOH has deployed 333 post-residency physicians and deployed 1,295 NDP nurses in DOH and LGU hospitals handling COVID-19 cases. In addition, there are 7,349 NDP nurses deployed in their respective communities who are involved in contact tracing and specimen collection or swabbing, and 3,471 public health associates who play active roles in contact tracing and surveillance. Other HRH who are in their assigned areas continue to provide essential health services in primary care and are also engaged in COVID-19 response, with focus on prevention of spread and surveillance in communities.
The next day, its WHO World Health Organization Philippines has been supporting the Department of Health Central Visayas Center for Health Development, CHD, and the Cebu City Health Department as they deal with the surge of confirmed COVID-19 cases in the region. The WHO team in Cebu provides technical support via contact tracing, training, surveillance, monitoring, among others. More recently, the team supported contact tracing in selected barangays and detention facilities. Cebu City Health Officer Dr. Daisy Villa shares, "We are very thankful for the support of WHO Philippines in our data management. Together with our other team members, we have gone to see the real situation on the ground, especially on the progress of contact tracing teams. Don't wait for your symptoms to get worse before seeking medical help. Like any illness, early intervention is the key to successful treatment of COVID-19. Getting treated early also ensures prompt assistance for your contacts. They could be more susceptible to the infection. COVID-19 is highly contagious or easily passed to others. We need everyone's assistance in detecting the disease early and stopping transmission at close contact. Let us help our medical frontliners by following simple steps."
Okay, July 12, 2020, Sunday, Policy in Focus. In line with the COVID-19 pandemic situation, the Department of Health, on behalf of the Interagency Task Force for Emerging Infectious Diseases, and in coordination with the Presidential Communications Operations Office through DOH Department Memorandum Number 2020-0280, is encouraging all Filipinos to take an active role in the fight against our common enemy, COVID-19, the kontrabida. The campaign promotes the active role of individuals in the fight against COVID-19 by practicing the following behaviors simplified into 4 letters. BIDA. B. Bawal walang mask. I. Isanitize ang mga kamay. Iwas hawak sa mga bagay. D. Dumistansya ng 1 metro. And A. Alamin ang totoong impormasyon. While quarantine measures have eased out in some areas, going outside for non-essential reasons is still discouraged. If truly needed, such as running errands or reporting to work, everyone is advised to observe minimum health standards. As part of the new normal, activities such as exercising outdoors should adhere to the precaution of physical distancing. The public is enjoined in applauding and appreciating our frontline healthcare workers who have been working tirelessly in attending to COVID-19 patients in hospitals and in other health and quarantine facilities across the country. The public is reminded to educate themselves on how to take care of house members with sickness. If symptoms worsen, contact your local BERT or BHeart immediately. COVID-19 poses difficulties for many people, especially when it comes to nursing infants. Thus, breastfeeding in the context of the pandemic must be carefully done to ensure safety.
And lastly, the Department of Health Philippines Undersecretary Leopoldo Vega, together with Vicente Soto Memorial Medical Center Chief Dr. Gerardo Aquino Jr., visited last Thursday, July 9, 2020 afternoon Cebu South Medical Center, also known as Talisay City District Hospital, St. Anthony Mother and Child Hospital, and the Cebu City Medical Center to check on the condition of these hospitals in attending COVID-19 cases. Yusek Leopoldo also met with public and private hospital administrators to build up the network of referrals among these hospitals. Mao gato ang atong mga pressers. Og next natong ipakita sa ato ang weekly report is now we go to our different charts and different graphs, no? Mao ni ang mga monthly distributions of COVID-19 cases of year 2020. Among ipahibaw nga ang atong ipakita mauni ang figure sulod sa Vicente Soto Memorial Medical Center. So mauni ang mga datos sa hospital. Okay? Right, Dr. Helen?
Yes. So we identify the cases of COVID-19 tested from our institution, from the VSMMC Subnational Laboratory.
Gikan
As
sa
of-
pagsugod yun ni, no?
Yes, from the very start. It's important to look at trends so we know whether or not we are truly flattening the curve.
Right. So let's see.
From the month of March, we had 2 cases and 0 deaths. When we move on to the month of April, we already have 35 cases and 9 deaths. But when we proceed to the month of May, okay, we had already 240 cases and 38 deaths. So increasing ang atong mga kaso. When
Right.
we look at June, when we looked at the month of June, we had 694 cases and 138 deaths. And
Okay.
now that we are in the month of July, we had a total of 273 cases thus far, no? With 61 deaths.
So kung imo na siyang makita diha no sa cumulative distribution gikan sa Marso 22 kutob sa July 15 mao na ang ending no. This is March to July 16, 2020 no. N is 1244. Ang blue mga ka-quarantine mao na atong mga kaso sulod sa hospital. Ang ato ang red mao na ang atong deaths. So this is how it look like sa ato ang data diri sa atong tambalanan sa Vicente Soto Memorial Medical Center. So unsay tan-aw nimo na Dr. Helen?
So hopefully no our cases are already decreasing no, but we have to look at how the next few weeks will turn out because the cases started coming in April, no, mainly in April, and then increasing number as we ramped up our testing.
Right.
And then it was during the time that the ECQ was relieved, lifted, when we had the GCQ for I think it was 15 days.
15 days.
And then we had an increase in the number of the cases that we detected,
Right.
as well as the number of deaths during that time towards the end of June.
So-
And hopefully, if you look at the trends, no, the numbers that we are detecting, despite the ramped up testing in Cebu, it seems to be decreasing.
Right.
But I am not a mathematician or a statistician, so I will not make predictions. I'm
Right.
not an epidemiologist, but we are hopeful. We are
Hopeful.
hoping for the best, but expecting the worst, that the numbers will continue to decrease.
And sa ako lang po, it's more on the practicality, no,
Yes.
practical side nga. Ang kining dagan nga inyong makita sa screen kanang mga graphs nato diha is magdepende gyud ni nato mga stakeholders if we continue the information dissemination that we have to protect ourselves from this virus, then this data that we are facing maybe this will change, di ba? Mo drop gyud ni siya. So kana lang padayon lang kita sa atong mga buhatonon nga dili nato siya mudaghan pa ni pag-usab. Ug na sa pangutana is unsa man ang daghan ani, ang babae ba, ang lalaki ba, pila may edad. Okay? So based on the data here in our hospital from the Hospital Epidemiology Surveillance Unit or HESO, sa edad nga 31 to 40, ubay-ubay gud ang mga babae, which is vulnerable to this,
yeah.
31 to 40 years old.
Yes, and we can see that this is the reproductive age, no, kini ang
Right.
edad nga mga nakay. And it's important to note, no, that Vicente Soto admits the most number of COVID positive infected pregnant women in the
Right.
whole country.
Oh. So ato pod sa side pod sa male no nga population sa Soto niha ato ni hisgutan ang Soto nga data. Cumulative age and gender distribution of cases, so napod siya sa 61 years old and above sa mga
Yes.
lalaki ang maximum no ang daghan. So inyo na dihang makita nga this is really kanang sa diri man gud sa Soto as a hospital, we have to really look at the data for better understanding and for better decision making, di ba?
Yes,
Kay we can
oo.
see unsaon nato ang mga himuono nato nga mga panglantaw or ato mga developments para ma-improve pa ang ato ang paghatag sa serbisyo.
And remember that these are patients who were admitted in VSMMC. So we
Alright.
can actually pinpoint among those females admitted in VSMMC, probably most of them, if not majority, are patients who come here to deliver.
Right, to deliver a baby or
Pregnancy,
a child, pregnancy,
yes.
okay? Ang sunod na to is the utilization rates of our our ICU beds from July 1 to 15. So,
Yes.
nihuman naman ta sa unang half, no, first half of our July, month of July, nutrition month. This is how we have our utilization for
Per
ICU
day.
beds.
Yes.
So, 67%, no? With an average of like 16 per day. So, look at that. That's how the graph is. Murag, mao na siya ang
It's
ato.
fairly constant. I would
Yeah.
say that it's fairly constant. And we have 24 ICU beds dedicated for COVID-19.
Right.
And our magic number to say that we are already overwhelmed, no, is 70%.
Right.
So far, we have still, no,
Controllable.
67%. Oo.
So, we call it controllable pa.
Yes. Oo.
Kay 70% man ang definition of an overwhelmed capacity.
Because as a government hospital, COVID referral hospital, we have the mandate to act like an accordion, no?
Accordion.
Mag-expand if
Expand.
needed and reduce if not needed.
Di pwede nga, ayaw na, kana na lang. No. As a government hospital, we need to expand. So,
And
but
we need
when
to
we do
find ways.
expansion, and when we find ways, we have to look at the available data. Okay?
Yes.
When to expand, when to implement this, and when to not implement as of the
Yes,
moment.
and there are parameters as to
Correct.
when we expand our areas, because each area opening up a new unit will require a complement of manpower.
And on the isolation beds, Doc Helen, from July 1 to 1 to 15, 2020, the average there is 53%. So this is the trend, no? 104 and 78. So
Yes,
how do you look at it, Dr. Helen?
Fairly stable across the each day of
Yeah.
the first 15 days of July.
Mao ni ato ang performance kung atong tanon ba nga kini makita na ni nato nga nag 53% layo pa gyud in town sa 70%. So
And remember, when we admit patients to VSMMC, most of them are severe and critical.
right.
Because
Very good.
although we have expanded to an extension at the IEC Bayanihan, this is where we admit patients who are mild or moderate COVID.
Right. Ato pong tan-awon mga stakeholders, no, kay report man ninamo ninyo diha while you are eating, wherever you are, you need to know at least your Vicente Soto Memorial Medical Center. Kini ang atong gi-report kay Soto Live man is the Soto data. Okay? Ato nang giklaro ha. This is not about the data nga sa gawas na sa hospital. Dinini sa atong hospital for you to know nga this is how we have our people. For COVID positive cases, tanaw na to ang mga positive. Okay. So, July 1, we started with 120 daily, no? And on July 16, no, naabot ta og 105. So, kung inyo nakita ang mga utilization ganina, medyo parihara porma, no? So,
Yes,
pariha na siya. They are related, no? So, it's 60% ang ato ang sa COVID positive cases.
Because
Okay?
we have a total of 185 beds dedicated for COVID-19 and 24 beds for ICU.
And on the other page, you have there previous month. The previous
Yes.
month is 51%. Okay? So those are our data of the hospital sa Vicente Soto, mga stakeholders nga pwede ninyo, kung namoy mga pangutana, you can send us in the inbox. Okay? So,
Okay.
mao kato ang ato ang mga data sa hospital sulod sa usa ka semana og half of July.
Yes, but if you'd like to know the status of Cebu as far as data and statistics and COVID trackers, it would be best to tune in to the Department of Health Region 7 website, and we requested that they would publish also their data. But we are doing as much as we can for transparency and accountability to let our ka-quarantines know the status of VSMMC.
Right. So, ang sunod natong ipakita sa inyo ha is mga happy na po nga stories. Maybe dili lang na mo isulti ang pangalan, but you will see also the video. Sa bayanihan nato nga field center, we have already released 3 survivors today. So,
Yan,
sini
oo.
sila? Very good, no? And these 3 survivors are healthcare workers.
Yes.
And another one, which is the 4th, our patient. So,
Oo.
atong tanawon ang ato ang send-off video sa IEC.
Maayong hapon mga quarantine, aduna na po kita'y upat ka buo COVID-19 survivor. O dakong pasalamat sa atong departamento. Ug adunay gamay na kahalipay para sa ato ang survivors gikan sa Bayanihan Center IUP. Naanin mga sunod ang mga hulagway sa ato ang mga COVID-19 survivors. Verb. So, sa kanina mga usod ni sir sa imong experience nato diri sa IEC Bayanihan?
Well, diri yun ako yung kuhaan na, no? Ay, mas komportable yun ang kanang mga patient diri. Yeah, well taken care ko po siya sa mga nurse, doctors. Sige, tawag ang doctors po. Yeah, mga nurse, baalag mamukaw kadlawon. Basta kay, at least, well taken care ko kuhaan yun.
Daghang salamat, sir.
Salamat, sir.
Pablo.
Salamat.
O kani, para sa inyong magikan sa atong Bayanihan IEC Center.
Thank you, thank you. Thank you yung tanan.
Okay, no? Bisan di ay bisag usa ka healthcare worker nya hero ka, di ba? Yung kag hero di naman ka ma-affected. Pwede gyud di ay, no?
Dili COVID proof ang atong mga heroes.
Yes, our heroes, our healthcare workers are not COVID proof. So pwede gyud di ay matakdan sa COVID-19. So mao na we are very happy that they are already out. One of them is a 27-year-old male, another one is 34-year-old, o ang usa is 28. So mao to nakita ganina dok, di ba?
Yes, oo.
20 to 40 years old,
Yes,
vulnerable gyud ay gihapon ani.
Oh, and remember that every single day that these healthcare workers come to work, they're actually risking their lives to infection with COVID-19.
Right.
It's really possible, no? There's high risk that they may contract the the SARS-CoV-2 virus in their line of work, and it's not just because it's their job, no? It's because it's a vocation, and they chose to be able to help patients who are afflicted.
Right. So kini siya mauni ang atuang IEC extension. We have 52 beds, 52 ang atuang
Yes.
slots dito sa duha ka chamber sa atong IEC area, okay? Sa atuang Bayanihan Center. So,
Okay.
mga ka-quarantine, paminaw gyud mo ani amo ang ihatag sa inyuha karon. Usag yun sa concern sa matag usa ka nato, it's asa tadapita magpa-test. Na ay mga kumpanya nga nag-ask nga testing, the result nya naglibog ang uban asa padulong. Kamo karon nga naminaw ni ining atong broadcast, ay isip kanang patilaw or just teaser para natong tanan. Ang Vicente Soto Memorial Medical Center naanya tay buhaton nga usa ka lakang, but sa dili pa kana ipakita na mo ninyo ang sample aning nahitabo ganina pa lang. Sige, please play this video. So that's our Medical Center Chief, Dr. Gerardo Aquino Jr. Ang inyong nakita mga kakwaranti, mao kini atong gitawag og swabbing para sa RT-PCR testing. Kay diri sa Soto, importante man kanato gyud nga mas gitawag nato role model. So gisugdan kini na mao na ang giswab ang ato ang Medical Center Chief sa Vicente Soto Memorial Medical Center. Mao kana si Dr. Gerardo M. Aquino Jr.
So these are members of our Execom
Right.
getting their first swab. Some of them, no, first timer.
Yeah, some are first timers, some are not first timers,
second
timer, three timer.
But the point is, they gave their consent.
So
to
mo ni
be
ang part sa
videoed.
ilong, Doc, no?
So
Nasal.
this is nasopharyngeal swabbing.
Again, ang inyong nakita mga quarantine, mao kana ang ato ang Incident Commander ug Medical Center Chief nini atong tambalanan si Dr. Gerardo M. Aquino Jr. Para ipakita nato nga ang testing, yes, it's okay. It's good to be tested for
Yes.
COVID-19.
This is for the benefit of our healthcare workers.
Correct.
Kay they will know their status.
Ang
Because,
kining sunod,
ayan, this is our
ako ning
Chief
gwapo
Administrative
nga, Chief
Officer.
Administrative Officer dinhi sa Soto, Attorney Paul Gino Lopez.
Yan.
Right. Sir, swabbing.
And it's important also to face our fears, no? So he wanted...
Medyo gilok siya.
Oo, yes.
Gilok ang iyahang sa ilong nga part na mura ka kanang natagak kani ka sa tubig mga quarantine,
Oh,
no?
yes.
Na natagak ka sa tubig nga kanang example nagboating ka niya, taga ka. So mao na siya, sakit siya sa ilong, murang nay dagat mo sud. Look at Attorney Paul there.
Oh, yan.
See, among gipakita sa inyo nga sugdan gyud ni sa atong mga leaders ni atong tambalanan. Kini, akong partner.
Ay, nako.
Wow, my partner, Dr. Helen Madamba. So, inyo makita diha si Dr. Helen padung na sa iyahang test, swabbing. Again, kini siya mauni ang swabbing para sa RT-PCR. Okay, so, open your mouth, Dr. Helen. There. So, see, you see how it is. That's really actual, and this is done by our medtechs from the Sub-National Laboratory, thanks to the team of Dr. Rinette Ligaray. So,
ayan.
nga kining adlaw July 17 nagsugod ta sa ato ang expanded testing para sa ato mga healthcare workers. Og after ani nga video na may announcement para ninyo diha nga nagtan-aw, o di ba? O ingon sila mahadlok medyo ni kurog ang naon ni doctor. It is like how can you describe the feeling kay ganina ako kay
mura ko nalumos, no? And then ayun.
Dr. Mabalatan. See?
Yan. So there's actually a scientific term for the one in oropharyngeal swab, no? It's the gag reflex. Mura ka musuka, no? But it's only for a moment. Because mura tickle.
Gitikol, mura ka gigilok mga quarantine.
Pero yung sa nasopharyngeal swab sa both nostrils, no? So you just need to get a sample at the very back of the nasopharyngeal cavity.
There.
Yan.
So, katong inyong nakita, okay, mga ka-quarantine, kato inyong mga nakita karon nga testing nga gisugdan gyud sa atong tagdumala nining atong tambalanan.
Yes.
May gani wa ko'y picture dito kay nilisog gyud akong mata. I also had my swabbing today. Medyo gilok gyud siya sa ilong. So why are we showing this to you? The Vicente Soto Memorial Medical Center is doing an expanded testing. Diba? We have to boost the testing, of our city and all the provinces.
Because it's a mandate we were mandated by the DOH, the Department of Health, to expand testing, do mass testing. Kasi the things that they told us, number one, you have to test. you
Yes,
have to do massive testing to identify those who are positive for COVID-19, and many of them may be even asymptomatic, walay gibati. And the second is, you have to trace. For those who test positive, you have to find their contacts, kinsa ang na-exposean og COVID-19.
Correct.
And for those who are vulnerable, importante ni kay kinahanglan ka protect the vulnerable population. So you have to trace, you have to test, you have to trace, and then you have to transfer. Imong i-isolate ang tanan nga mag-COVID positive aron ang mga elderly, those vulnerable, those with comorbid conditions, sa mga mabdos, dili na ma-expose sa mga naay COVID.
Dili na ba sad advisable no sa IITF ang home quarantine?
Dili na. So
kaya
we
dapat
have
ato na ta sa isolation center.
facilities.
Okay.
And the last is to treat. Importante na kay bawta unsa ang gibati sa mga pasyente nga naay COVID, di ba? The symptoms of COVID-19. So we should not be in denial, no? We should identify kung unsa ang mga sintomas like difficulty of breathing, hatching, cough, colds, or fever, no? Loss of smell, loss of taste, or even diarrhea, no? GI symptoms. Why? Because you have to consult the doctor, the nearest healthcare worker, so that you can access healthcare. Because our statistics show that most of those who die of COVID die at the ER, dead on arrival, or dies less than 48 hours. Meaning, nagpakonsulta sila, it's already too late. So we want to be able to catch COVID in its early forms aron naapatay mabuhat ug makasurvive ang atong mga pasyente.
So tungod ana no among gipakita ninyo ang unsay feeling gisugdan sa ato ang management. Sa sunod unya nga semana atangi ninyo sa ato ang Facebook page o sa Soto Live. Kay naa unya tay gitawag og walk-through, dili siya walk-in but walk-through and drive-through testing. Kung naa kay sakyanan mga ka-quarantine, then you do the drive-through. Kung naa kay wa kay sakyanan batuol inyong lugar, also you do the walk-through. Usa kini siya ka programa sa hospital, kini teaser pa ni kay among ipakita ninyo nga you are going to do this online.
Yes.
Meaning to say, it's 10 people or 10 clients per hour for drive-through. Kay moagi pa man ka sa tent nga nag-drive ra ka. Kung pakaingon ka ng mga kananan nga na drive-through, mao na itong gipasabot mag-drive-through. And then for those kuan board walk-through, nang gihapon ta sa atong ihatag ninyo nga link sa atong Facebook page, kini magsugod sa sunod nato nga semana.
So the reason why we don't want you to just walk in and we want you to register online is because we don't want you to be waiting so long. Di ta gusto nga mag-traffic diha sa B. Rodriguez. So we will only entertain as much as possible those who have already scheduled for their swab online. So after the online registration, then that is your opportunity to fill up the case investigation form online. And it's very important that you provide true and correct information. Because the email address is your ticket to registering online, and then you will be given a particular schedule kung kanus mo drive through or mag walk through. And then on your schedule, then you will be accommodated for swab testing for COVID-19. And this is free of charge, and the results will be emailed to you, or you can also pick up the results at the hospital.
Correct. So mao kini, we will show to you some the layout of this drive-through and walk-through. Akong ginabalikon, atangin ninyo sa detalye sa ato ang Facebook page sa Vicente Soto Memorial Medical Center para kamo diha sa mga panimalay na isakyanan, put together, enroll online, and then do your swabbing for free here in Soto. Abangan ang susunod na kabanata. Pakita na to ang ato ang sample niya nga kuan. Mapa, natay mapa. wala pa
sige.
dihang mapa. So,
The
atanginan
details,
ninyo.
we will post that soon.
Right. So,
And for
you
all
have
of this, we would like to thank Dr. Aquino,
Gerardo
Dr.
Aquino
Gerardo
Jr.
M. Aquino Jr., our producer, Medical Center Chief, and Incident Commander. Always finding ways to make things happen.
And of course, to our Department of Health Regional Director of 7, Dr. Jaime Bernadas and his team.
Ayan. Also, we would like to thank our provincial government and the city health departments of the Tri-Cities and even the level of the barangays, the barangay health workers and the BHERT. We are all part of one big community of healthcare workers and healthcare providers. And of course, we want to congratulate, this is an innovative project of the VSMMC Subnational Laboratory. Headed by Dr. Reynet Ligaray. Congratulations po, ma'am.
Ako sang atong i-greet karon ang atong finance officer, the
Ayan.
FMO, Finance and Management Officer sa Vicente Soto Memorial Medical Center. Wailain, ang gwapa kayo na to nga FMO,
yes.
Ma'am Maureen Bien. Happy birthday! Happy birthday, Miss Mau.
Yan.
Kini si Miss Mau is the smiling, they give me mo age kay ang beauty, grabe na. Anyway,
And,
padayon ka mo sa pag-follow and like,
social
okay?
media
Para kahibaw ta
platforms.
sa ato ang buhatonon sa online nato nga how do you call this? Registration for the walkthrough, drive-through
So,
testing nga
watch
kini lang
out.
dinhi sa Soto.
Watch out on YouTube. We have VSMMC, Vicente Soto Memorial Medical Center. Twitter and Facebook, we had @official VSMMC. And if you'd like to message us and send us your photos and videos and even your complaints and feedback, you can email us at vsmmc_osm@yahoo.com.
Alright, so padayon ka mo sa pag-follow, pagtanaw sa ato mga Facebook page, mga online platforms para always mo inform o kahibaw mo, makakuha mo og slots sa ato ang walkthrough and drive-through testing. Dinhilang ka na sa Soto. Kay ngano, Dr. Helen?
Kay dinhi sa Soto,
Kalidad nga serbisyo among garbo.
garbo.
Kini si Atty. Panugaling.
Kini si Dr. Helen Madamba.
Mao kini ang Soto Live. Mayong
Mayong
gabi.
gabi.